to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome to our very first Ask the Patient Advocate podcast. I am so excited to discuss such an important topic. Let me first talk about why the decision was made to create a podcast. First off, I want to educate on what an independent patient advocate is. Despite working as a private or independent patient advocate for several years now, my company, Pathway Patient Advocates, and I receive so many inquiries asking the questions, what is a patient advocate and why do I need one? Second reason is that healthcare is constantly changing, and there's so many great resources to share and topics to discuss regarding that. So Ask the Patient Advocate podcast will be used for exactly that. So let me get started with answering the questions. What is a private or independent patient advocate? There are different definitions of the term patient advocate, and private patient advocacy especially is a fairly new concept. Without knowing the different definitions, you can't really understand why you need a private patient advocate. In addition, a private patient advocate is often called a health advocate, a medical advocate, a medical navigator, or a professional. And we'll go over some more reasons how that can be a little bit more confusing as well. So let's first talk about some of the advantages. One of the key advantages of having a private patient advocate is that a private patient advocate, like Pathway Patient Advocates, is an unbiased individual who is not affiliated with a specific healthcare system or insurance company. A private patient advocate is someone who works for you to help you navigate your health and your healthcare challenges. In addition, a private patient advocate will never have you feeling alone because we can help you with a variety of challenges, including new diagnoses, undiagnosed symptoms, rare disorders, cancer, elderly care management, medical billing, insurance issues, and so on and so on. And so the other important thing to note is that to add to your confusion, you may be familiar with a patient advocate that's offered by your healthcare system or insurance plan. Despite the name, this is distinctly different from a private patient advocate. A private patient advocate has different education, certification, experience, and specialization that equips them to advocate for your best interest without the constraints of staying within a healthcare system or insurance system. So there is so many different things that a private patient advocate like myself can assist you with. First, it's really important to me that one of the favorite parts of my job is that I provide a specialized approach to each and every patient. That being said, I can assist with a variety of additional ways that I'm not going to be mentioning. Some examples of Pathway Patient Advocate assistance includes navigating your health and healthcare system. This includes reviewing medical records, looking for errors and gaps in care, and organizing records that are easily accessible and understandable to you and your healthcare team. Also, improving communication in essentially all aspects. This includes communicating with your doctors, nurses, and other providers to help optimize your healthcare. In addition to communicating with your healthcare team, it's equally important to help you understand all testing, treatment, research, and different options, as well as any family members or loved ones that you wish to share these details with or make them understand certain things. Sometimes updating family and loved ones becomes a chore in itself, especially when you are going through the healthcare challenges yourself. So a private patient advocate can offset that a challenge for you. In addition to what I mentioned, I can also help with researching treatment options. This includes arranging second opinions or third opinions or fourth opinions, new treatment options, clinical trials, and so much more. We can also help advocate for your patient rights, accompany you to medical appointments, advocate for you while you're in the hospital, and continue to coordinate your care. Insurance and billing issues are also common when navigating your health. Let us take the burden off of you and help manage these issues so that you can focus on your health. So I hope that gives you a better understanding of what a private patient advocate actually is and why you specifically need one. I'm looking forward to next time. Have a great day. God bless. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.